Welcome to our video on safe and effective insulin administration, presented by Devoted Care Services, LLC. This session is designed to provide caregivers with the knowledge and information necessary to administer insulin correctly and safely. Let's get started. Let's begin with a basic question. What is insulin? Insulin is a hormone produced by the pancreas that plays a vital role in regulating blood sugar levels. It allows glucose from food to enter cells, where it's either used for energy or stored for future use. Insulin comes in different types, each tailored to meet specific needs. Let's explore these types in detail. Rapid-acting insulin works quickly, starting within 15 minutes, making it ideal for managing blood sugar spikes during meals. It peaks within an hour and lasts up to 5 hours. Short-acting insulin begins working in about 30 minutes with its peak effect around 2 to 4 hours and lasts for 6 to 8 hours. Intermediate-acting insulin takes 1 to 2 hours to start working and provides coverage for about 12 to 18 hours. Finally, long-acting insulin offers steady, consistent glucose control for 24 hours or longer, often requiring just 1 dose a day. Understanding these types helps us match the right insulin to the patient's needs. Now, on to understanding what your blood sugar level means. Maintaining blood sugar levels within the normal range is essential for avoiding complications. Fasting blood sugar levels should be between 70 and 99 milligrams per deciliter, while post-meal levels should remain below 140 milligrams per deciliter. It's crucial to recognize the signs of hypoglycemia, such as sweating, shakiness, and confusion, which indicate low blood sugar. On the other hand, symptoms of hyperglycemia include fatigue, excessive thirst, and frequent urination, signaling high blood sugar. Regular monitoring using a glucometer is key. This process involves pricking a finger, applying blood to a test strip, and recording the result. Monitoring ensures patients and caregivers can make informed decisions about insulin and dietary adjustments. Ensuring safe insulin administration begins before a caregiver is assigned to a client. First, it's essential for a nurse or healthcare professional to evaluate the caregiver's skills and confirm they are competent to perform this task. Once assigned, the caregiver must obtain the client's consent before administering insulin. This step is critical in respecting the client's autonomy and building trust. Additionally, caregivers should verify their authorization to administer insulin, as outlined in the care plan. These measures prioritize client safety and maintain the highest standards of care. Now let's discuss the steps for administering insulin safely and effectively. Preparation is the first step. Always wash your hands thoroughly and wear gloves to maintain hygiene. Check the insulin vial or pen to ensure it is not expired and that the liquid is clear and free of particles. Next, confirm the prescribed dose, adjusting it if directed by a healthcare provider based on the patient's blood sugar levels. When choosing an injection site, the abdomen is often preferred for its rapid absorption, while the thigh and upper arm offer moderate and slower absorption, respectively. Rotate injection sites regularly to prevent lipodystrophy, a condition where fatty tissue hardens and affects insulin absorption. For the injection itself, start by cleaning the site with an alcohol swab. Pinch the skin if needed and insert the needle at the correct angle, usually 90 degrees unless the patient is thin, in which case a 45-degree angle may be better. Inject the insulin slowly and steadily, then withdraw the needle and apply gentle pressure to the site. Finally, dispose of the used needle in a sharps container to ensure safety. Following these steps helps maintain both patient safety and the effectiveness of the insulin therapy. Managing emergencies and following best practices are crucial for effective insulin administration. For hypoglycemia, quickly administer 15 grams of glucose and recheck blood sugar after 15 minutes. For hyperglycemia, use corrective insulin as prescribed and consult a healthcare provider if symptoms persist. Always keep emergency contacts and protocols accessible. In addition, ensure proper insulin storage by refrigerating unopened insulin and using opened insulin within 28 days, keeping it at room temperature. Dispose of needles safely in designated sharps containers to prevent injury or contamination. Adhering to these guidelines promotes safety and optimal outcomes for patients. Thank you for joining us for this session on safe and effective insulin administration. For more information or assistance, feel free to contact us at Devoted Care Services. We are here to support you in providing exceptional care.